So this idea of screening, and there's a lot of controversy in this actually. So screening came out of this sort of genetic paradigm that if you could find a cancer at its very earliest stages, then you'll get rid of it and then you won't have to worry about it again. That doesn't happen. That doesn't work if you think of it as an invasive species. It's just like saying if we find a bacteria in you, I'm going to give you heavy duty antibiotics and wipe out everything. It's not going to make you healthier. In fact, they'll make you quite a bit sicker in the long run because those bacteria will just come back eventually and they'll be worse the second time and third time and fourth time, right? So at no point do we ever say to somebody, we need to get rid of every single bacteria in the body, because there's good bacteria, there's bad bacteria, and they get along fine. It's just like that, that whole movement before COVID anyway, let them eat dirt, right? Which is that idea that too much cleanliness is not that good a thing. You're actually not exposing yourself. Same thing with the peanut allergies, right? With the peanut allergies, the initial thought was, let's get rid of every single peanut we can find on this planet, and then there will be no peanut allergies, right? Didn't work. It actually made the peanut allergy worse, which is a different story. But because people were never exposed to it, when they were, it was life-threatening exposure, as opposed to people who always had low-level exposures, like people in Thailand, for example, who eat a lot of peanuts. They don't have very many peanut allergies because most people are exposed to it at a low level. When they get exposed to it, they get a little sick, as opposed to, a little sick all the time, as opposed to one time you see it and you're just really, really sick and could die. So it's the same thing. It opens up all these new ideas, because if you get rid of every single cancer that you can find, well, you're just going to be whacking out pieces of yourself all over the place, right? So it's not going to do you any good. So screening comes out of that. So if you find a very, very early cancer, you don't necessarily have to hit it with, the hardest thing. They did this in South Korea, for example, where they did screening for thyroid cancer. So they ultrasounded people's thyroid, and if they found a thyroid cancer, they'd take it out. The problem is almost all of those thyroid cancers were never going to be a problem, because your own anti-cancer forces would have kept it in check. So you actually derive no benefit whatsoever. So as people, they whacked out all these thyroids in people, the incidence of thyroid cancer skyrocketed because they're finding so many more that they never found before. So it went up 10 times, but the mortality, the number of people dying of thyroid cancer, was unchanged, because those were thyroid cancers you didn't actually have to worry about. So this idea is that if you're finding super early cancers that would never have been a problem, and this is the controversial part, right? You see this in prostate cancer and you see this in breast cancer. So this is screening with PSA and screening with mammography. And if you do, let's take mammography as an example. If you do very early mammography, you're going to find a lot of cancers that never needed to be treated. You're going to take out a lot of breasts, and you're going to do a lot of radiation in a lot of people who won't benefit ultimately from that. So in fact, the data for screening from mammography is so controversial that they've actually gone backwards. They had originally pushed the sort of said, oh, you should do mammography at age 40, and then now they've pushed it back out in some cases to 50. Now there's a lot of controversy on, some people think it's a good thing, some people think it's a bad thing, but it comes out of this idea that finding it too early is not necessarily something that you have to deal with, because we can deal with it ourselves. It's more of that, yes, it's like finding a bacteria on your skin. Yes, there's bacteria on your skin, but so what, right? It's going to be fine. It's never going to be a problem, so don't cut that out. So it's just an interesting way of looking at it, that all these things start to make more sense. Because if you took the genetic paradigm, it would have said that, hey, if you find a very early cancer, you should take care of it right away, immediately, because it will become a worse cancer. That's not necessarily the case.
And coming back to your thyroid example there, you didn't talk about this aspect as well. There's so many different layers to this. The fact that if you're taking a thyroid out, that has, profound functions in the body for it to be healthy. And you're now removing that, so the body's not going to be as healthy as it was before.
Absolutely.
Plus the
And
stress layer, you're going to stress that person out. That's going to raise cortisol in the system. And then that's causing a whole influx of stress response chronically for that person.
exactly. And this is the controversy, because it's not like the treatments have no side effects, right? So if you do uh, lumpectomies, and if you do a lot of lumpectomies and radiation for early breast cancer, you're going to get side effects because you're doing so many of these, right? There's surgical side effects, there's radiation side effects. So your benefits must outweigh those risks. So at some point, right, and everything in medicine is sort of risk versus benefit. At some point, the risk of that early stage cancer in a normal person is so low that the risk of treatment is much higher than the risk of the cancer itself, right? And that's the same problem you see with antibiotics, and that's why people say we're giving too many antibiotics, because it's so easy to give antibiotics that you're giving it for situations where there's almost no benefit to the antibiotic, but now you're getting the risk of and there's no benefit, but the risk is starting, because the benefit's so low, the risk is actually higher than the benefit. Same thing with these treatments. So people have been talking about not doing PSA screening, about pushing up the age of mammography. There's controversy about chest X-ray screenings, and you can start to understand the sort of underpinnings if you look at it from the evolutionary standpoint as opposed to the genetic standpoint, because screening everybody with a CT every year from age 10 sort of makes sense from a genetic standpoint. It doesn't make any sense from the evolutionary paradigm.
You make such a good point, and I wanted to go there as well. The fact that these treatments could, contribute to cancer, the modalities being used, or the screening methods. Which brings me to something you talk about in your book, which is fascinating. The fact that cancer drugs actually cause cancer.
Yeah, and that's the interesting thing, because the original cancer drugs, remember, are based on killing cells, right? So the chemotherapies, the surgeries, you're trying to cut it out, you're trying to burn it with radiation, or you're trying to poison it. So that's damage to the cells. Well, if you think about the evolutionary paradigm says when you're damaging cells, cells are going to evolve to a more survivalist state, or move towards that single-celled state that we all had, right, in response to cell damage. So you've got all these treatments that are damaging cells because we've designed them to damage cells. So the very treatments from sort of the paradigm one, the very treatments that we use to cure cancer also cause cancer, right? And you can't understand that until you get to the evolutionary paradigm, which is fascinating, because if you think about chemotherapy, we've all known this. We've known this for 30 years. If you treat somebody with chemotherapy like cyclophosphamide, you get what's called secondary malignancies. That is, you treat somebody for lymphoma, 20 years later, the risk of, bladder cancer will go up, or something like that, right? You treat somebody with radiation, their risk of cancer goes up. You radiate somebody, you give chronic, surgery, you can get, damage at the surgical site. You can get cancers at the surgical site. So all of those treatments that we use to kill cells and to treat cancer also cause cancer. And that's the reason why.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
These studies have been replicated over and over and over for the last 30 years of attributable risk. And diet and obesity is that second huge bucket, and nobody's talking about it.